Trump administration's proposed cuts to government agencies and programs, including to the National Institute of Health. A federal judge has temporarily blocked the move, but we want to get into what's at stake here. For that, we're joined by Dr. Larry Corey, a renowned expert on virology at one of the nation's top cancer research institutes. Dr. Corey, thank you so much for your time. As we know, the NIH is our country's primary agency for medical research. What would be the consequences, would you say, from Trump's proposed cuts?
Well, I think the consequences would be quite draconian for our research infrastructure, as well as the people who are currently working in medical research. Of the $48 million a year on the NIH budget, $40 billion gets distributed throughout our country's research institutions through a very highly competitive scientific review system. It's really the ultimate meritocracy. And the American people see this through their medical schools and the medical research facilities that essentially are paid for it by their states and their local regions. And all the innovations that emanate, let's say the cholesterol-lowering drugs, the immunotherapy for cancers, the discovery of the new anti-obesity medications, the inroads that are showing, let's say, Alzheimer's disease are due to excess protein accumulations and the things that we're now utilizing in order to prevent this from happening. They all emanate from NIH funding of our medical science. And this sort of draconian loss of the infrastructure is really of concern to all of us in the medical research enterprise.
As you know, the Trump administration ordered a 15% cap on NIH grants that fund indirect costs like facilities and building expenses. Do you see any merit in their argument that cutting from NIH grants is necessary in order to reduce government spending?
Well, medical research buildings are essentially the factories of medical research. Yes, they're expensive to build, $6,000, $7,000 a square feet. They have modern technologies, equipment, crystallography, electron microscopes, mass specs. These all cost large amounts of money. And the buildings and equipment to do research are truly research costs. The electricians at my institute and the airflow people who take care of all the equipment are as important to the enterprise as any of us faculty members sitting at their computers designing new molecules.
In your long career, you've been on the forefront of virology research, including at the Fred Hutchinson Cancer Center. And we know that you're not speaking on behalf of the center today, but your work has helped us better understand viruses like HIV, coronavirus. How important is NIH funding to make this work possible?
NIH is the conduit of our biomedical innovations in both the country and globally. And without the NIH, we would not be the leading medical research country in the world. And it is through the NIH and its funding and its ability to subsidize and innovate research that these discoveries are made.
If you had a crystal ball, how do you think that this will all play out? Because a number of people like yourself are really in strong opposition to the NIH getting the hatchet here.
I obviously don't have a crystal ball. But I do know that it's affecting people, especially young people who want to go and research, which is the pipeline of will they sacrifice all the years of hard work that they go into making a scientific career? Could they do that if the country does not appreciate and value what they're doing?
Dr. Larry Corey, we thank you so much for your time and insight.